Hi, my name is Lloydette Brewa, and my innovation project is about symptom management during cancer treatment. This project will assist nurses in oncology of how to take care of patients um, during cancer treatment when they have predictable symptoms. During treatment, many symptoms interfere with quality of life, and clinicians, especially nurses who may not understand comprehensive assessments of treatments to determine plan of care, are, are sometimes in limbo as to how to proceed. This is mostly seen in acute hospitals where oncology patients are blended with med surge patients or in med surge units. A solution to break this barrier to provide high quality cancer care is needed. Algorithms can help prevent unnecessary variations in cancer care. It could eliminate the lack of standardization or adherence to guidelines during diagnosis, treatments, and also surveillance. Experts suggested improving cancer patients' experiences and quality of life could be done by standardizing care. Oncology apps is most relevant to my innovation project. This app usage will result in safety of the oncology patient and usable tool for improved overall efficiency in care and cost. The main ideology of this innovation is safety and improving general quality of life. This is the background and significance. Okay, and this app, the issues are faced by clinicians in all settings, and algorithms can improve the assessment process, and a quality focused assessment and treatment could be rendered. According to Johansson, collaboration with collaborators could actually improve innovative projects. I decided to involve um, three different uh, collaborators. I use clinicians, a physician assistant, and an oncologist, and nurses. And I also used an insurance authorization designee, and I used a patient and a caregiver. Johansson in our book describes the importance of collaborators, and she stated to strike a balance within depth and breadth. Um, it is important to uh, bring together collaborators to give different perspectives, and an explosion of an intersection uh, would actually bring out a more efficient and a more succinct project. I decided to start off with the insurance authorization designee as my first collaborator to see where cost efficiency and funding sources, how to see how important that would be. The insurance designee's job is basically to screen for insurance for funding, and also she's very well versed um, in treatments that's covered and reimbursable, and how they're reimbursable. So she was my initial consult person. She looked at the app and saw some very good qualities of the app, and she figured that some of the treatments that's on the app may be covered. Sometimes they're not covered depending on the insurance. Um, but overall, she thought it was a good app um, in terms of reimbursement for treatments, medications, referrals, diagnostic studies, and so on. She was able to tell me about the trends in reimbursements and how they reimbursed. My next collaborators were the clinicians, the oncologists, physician assistants, and the oncology nurse. The oncologist was receptive to the app, but uh, because oncology have guidelines, and he thought that the app could be used when uh, most of the protocols on the guidelines have been exhausted. He thinks that the app can be useful for rare symptoms that are not commonly seen. And my next collaborator in this group was the physician assistant. She was not very interested in the app. She's not used to using apps, and she voiced concern about patients using such app to request individualized or overuse of treatment. And that was a concept that I had not thought about. So that was really great that she had that point of view. After I showed her how the app worked, she thought she could use it as well in the capacity, as the oncologist had noted, of using it on patients that do not respond to NCCN guidelines or oncology guidelines that are followed. And for the nurses, they were the most receptive to this app. They thought that they could use this app to ensure that all bases are covered, such as during triages by phone, and to follow protocols that are missed, and they thought that the precision in this type of app could reduce cost and make good on personalized care. Christiansen describes specialty clinics as a precision medicine model that could reduce cost and also could personalized care, as the nurses had thought. Outpatient cancer settings provide specialized services to cancer patients for convenience and speed, but they also lack innovation and somewhat contributes to downward quality and efficacy. My third collaborators were the patient and the caregiver. I chose the patient, a patient survivor and her caregiver, because they have gone through this process, and I showed them the app, and they they were somewhat receptive, but thought that the app had a lot more detailed um, medical terminologies and treatment models, that they lack the proper knowledge to um, interpret. And also, they felt like if if they had received focused um, teaching in cancer care, that this could have helped for them to use an app such as this one. Um, but they thought that they could use some portions of the app to improve their knowledge, and also to check on um, certain treatments that they receive, to just make sure that it's in line with um, what their symptoms are. So that was partly uh, useful for patients and the caregiver, and in some portions of it, they were not very receptive because of the extent of the medical background that's needed to interpret um, that portion of the app. Well, the mobile app that I chose is Symptom Management app of for patients during cancer treatment. This app is free and could be used on any smartphone from the AT&T network app store. It is a cancer symptom management algorithm designed to help guide assessment and care planning based on the severity of the symptoms. It has 5 key symptoms that affect quality of life while patients receive cancer treatments. This app helps the healthcare professional to think broadly when a patient may call to report issues or present with those core symptoms, um, 5 key symptoms that pertains to any of those 5 issues listed: pain, dyspnea, depression, nausea and vomiting, and delirium. Uh, these are 5 of 9 key symptoms that usually cancer patients experience. Each of the care planning guide is condensed to a portable companion that starts off with 8 assessment care pathways. It starts off with the onset, the quality, um, the region of the body, severity, psychosocial impact,